The decision for unprecedented government-mandated lockdowns has been based on the alleged death rate of COVID-19. Is this death rate based on truth? Inquiring minds want to know, are the reported deaths from COVID-19 truly deaths from COVID-19? To address this question, we need to discuss death certificates, since death certificates are the basic source of information about mortality. The discussion of death certificates is not a fun one. We have all grieved so many losses in our lifetimes. Still, we need to talk about it because they are the basis of the so-called death rate of COVID-19. History-changing decisions are being made due to these figures, despite the fact that they are flat out wrong, based on data that is insufficient and often inaccurate. Few people know how much individual power and leeway is given to the physician, coroner, or medical examiner signing the death certificate. How do I know this? I've been filling out death certificates for over 30 years. More often than we want to admit, we don't know with certainty the cause of death when we fill out death certificates. That is just life. We are doctors, not God. Autopsies are rarely performed, and even when an autopsy is done, the actual cause of death is not always clear. Physicians make their best guesstimate and fill out the form. Then that listed cause of death, whatever we list, is entered into a vital records data bank to use for statistical analysis, which then gives out inaccurate numbers, as you can imagine. Those inaccurate numbers then become accepted as factual information, even though much of it is false. So, even before we heard of COVID-19, death certificates were based on assumptions and educated guesses that go unquestioned. When it comes to COVID-19, there is the additional data skewer that is, get this, there is no universal definition of COVID-19 death. The Center for Disease Control, updated from yesterday, April 4th, still states that mortality, quote-unquote, data includes both confirmed and presumptive positive cases of COVID-19. That's from their website. Translation, the CDC counts both true COVID-19 cases and speculative guesses of COVID-19 the same. They call it death by COVID-19. They automatically overestimate the real death numbers by their own admission. Prior to COVID-19, people were more likely to get an accurate cause of death written on their death certificate if they died in the hospital. Why more accurate when a patient dies in the hospital? Because hospital staff has physical exam findings, labs, radiologic studies, etc., to make a good, educated guess. It is estimated that 60% of people die in the hospital. But even those in hospital deaths, the cause of death is not always clear, especially in someone with multiple health conditions, each of which could cause the death. Clear-cut causes of death might include traumatic brain injury, say from a car accident, intractable seizures or asthma, sepsis from overwhelming infection, respiratory arrest from a COPD exacerbation, ruptured aneurysm, metastatic cancer, massive acute heart attack, stroke, or pulmonary embolism. I will talk more in a little bit about why inaccuracy in the cause of death has declined for hospital deaths with the introduction of COVID-19 testing. There are also unclear causes of death in ambulances. That's a reality. An example would be someone with multiple deadly conditions who gets short of breath and dies before evaluation can be done. Was it the patient's underlying lung disease or heart disease that caused the shortness of breath, that caused them to call the ambulance? Or was there a concomitant pneumonia or other problem? We don't know because the patient died before the incident could be evaluated. So an estimated 60% of people die in the hospital. As to the other 40%, it is estimated about 20% of people die at home and 20% in nursing homes in this country. The true cause of death in these situations usually remains unknown. The death certificate is filled out with the best educated guess. Unknown causes of death include elderly people or younger people with known heart disease who die peacefully in their sleep. It is not acceptable to list old age as a cause of death, even though that may be more accurate than the cause of death we often list on the death certificate. We are allowed to state as a cause of death atherosclerotic cardiovascular disease, and that may be our best guess in a lot of these cases. But is it truly the cause? Who knows? Only God in heaven knows. Amen? So allow me to give a real-world example. One of my patient's fathers died about 17 years ago. He was old and in the final days of terminal cancer. He also had heart disease, but was too old and too sick to get heart bypass surgery. As he got near the end of his life, he came down with what appeared to be pneumonia. As my patient, this man's son, stood by his father's sick bed at home, the man died. No one else was there. The mortician was called and removed the body at about 2 in the morning. The next day, the funeral home called and asked my patient, the son of this man, what time did he die and what was the cause? The death certificate listed the man's son's best guess. The cause of death made by the deceased man's son was made official. He was cremated, so there was no second opinion. This man didn't even have any medical training that gave the diagnosis to the mortician. This happens all the time, especially in poor urban areas, casual country towns, and rural areas. In the case of my patient's father, did an accurate cause of death matter? Not really. But today, when governments are making massive changes that affect our constitutional rights, and those changes are based on inaccurate statistics, it does matter. There's a U.S. standard for death certificates that includes a line for immediate cause of death, followed by 2 to 3 lines of antecedent causes, giving rise to the immediate cause, then 1 to 2 lines of other significant conditions contributing to the death, but not causally related to the immediate cause. For an example, immediate cause of death, sepsis, antecedent cause, pneumococcal pneumonia, other significant conditions, COPD. Okay, let's combine the information I've given you so far about the guesswork involved in filling out death certificates and apply it to COVID-19. The analysis that follows requires the presupposition that in today's medical climate, many, if not most, patients sick enough to be hospitalized will be checked for COVID-19. It also requires an understanding of what we know at this point, that most people who test positive for COVID-19 have mild or no symptoms. Therefore, testing positive for COVID-19 does not mean a person is sick with it, or if the person died, that they died from it. To drive this home, we need to understand how the CDC and National Vital Statistics System are instructing physicians to fill out death certificates related to COVID-19. Brace yourselves, and please pay attention, and let what I'm about to tell you sink in. The assumption of COVID-19 death can be made even without testing. Based on assumption alone, the death can be reported to the public as another COVID-19 casualty. The March 24th, 2020 National Vital Statistics System memo states, and I quote, "The rules for coding and selection of the underlying cause of death are expected to result in COVID-19 being the underlying cause more often than not." End of quote. The CDC report of cases in the U.S. memo from yesterday states the death numbers are preliminary, quote, and have not been confirmed. So, quote, the results are preliminary and have not been confirmed, end of quote. It's from the CDC website. Here's a quote even more laden with meaning. Stephen Schwartz, National Director of the Division of Vital Statistics, says in answer to the question as stated in the organization's COVID-19 alert, quote, "Should COVID-19 be reported on the death certificate only with a confirmed test?" Check out his answer, and I quote from this memo of which I have a copy, quote, "COVID-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc. End of quote. I'm sure you all feel so reassured the government is asking doctors to provide their very best guesswork. Not. Fact, quote, COVID-19 caused death, end of quote, and, quote, assumed death by COVID-19, end of quote, are not the same thing. And for those who died from something else and had an incidental finding of COVID-19 positivity, dying with COVID-19 is not the same as dying from COVID-19. I'm almost done, but want to clarify the process with another patient example. This is something that could happen commonly. It's not a specific patient I'm thinking of. Let's say it's a sick patient who goes into respiratory arrest at home. He is intubated at home by EMTs. They put a tube down his throat to help him breathe. He's taken to the hospital by ambulance, put on a ventilator in the ICU, put on antibiotics for presumed sepsis, given IV fluids because his blood pressure has bottomed out. The bacteria pneumococcus is found in the blood and sputum cultures. Pneumonia is seen on the chest x-ray. Despite the staff's best efforts, he dies 2 days after admission. Like I said, this is not an uncommon scenario. The patient was found to be COVID-19 positive, and the doctor has the option of listing on the death certificate that COVID-19 is the immediate or antecedent cause because the doctor theorizes that COVID-19 contributed. Either way, it goes into the data bank as caused by COVID-19. To reiterate, if a patient tests positive for COVID-19 and dies from another cause such as pneumococcal sepsis, it may be considered accurate to say that person died with COVID-19, not from COVID-19. Yet the CDC guidelines list they list this case as one more COVID-19 death, and they go to the next questionable death. They label that as COVID-19, and it goes on and on. You could see how these statistics have been made to look really scary when it is so easy to add false numbers to the official database. Those false numbers are sanctioned by the CDC as of their memo yesterday, April 4th. I have made physical copies of those memos in case more people start looking at their website and they decide it's too much truth for us. I hope I was able to make my point. The real number of COVID-19 deaths are not what most people are told and what they then think. How many people have actually died from COVID-19 is anyone's guess. Again, God only knows. But based on how death certificates are being filled out, you can be certain the number is substantially lower than what we are being told. Based on inaccurate, incomplete data, people are being terrorized by fearmongers into relinquishing cherished freedoms. Thank you. Oh, and I have a little PS. Forgot about. You can't have a true case fatality rate without testing massive numbers of people, but that is another topic. What is that old saying? Something along the line, figures don't lie, but liars sure can figure. Thank you.
A Minnesota state senator says officials are asking doctors to fill out death certificates with diagnosis of COVID-19, whether the person died of it or not. Valley News Team's Callie Hubbard talked to the lawmaker today, who says fear may be coming into play.
Minnesota Senator and Dr. Scott Jensen says he received a 7-page document from the Minnesota Department of Health on how doctors should go about filling out a cause of death certificate. The letter from the Minnesota Department of Health gives advice to physicians, physician assistants, and others who certify deaths. The doctor says the letter takes you to a CDC website that has recommendations on how to include COVID-19 as a diagnosis for someone who was never tested for COVID-19.
Say I have a nursing home patient who's frail and 88 years old and comes down with a cough and a fever, and after 3 days ends up passing away from pneumonia. I'm not going to put influenza on that death certificate. So I doubt that I would be inclined to put COVID-19.
Dr. Jensen says each state's reported death numbers are making a lot of people fearful, adding that getting the number right is critical, especially during a pandemic.
I worry that sometimes we're so darn interested in just jazzing up the fear factor that sometimes people's ability to think for themselves is paralyzed if they're frightened enough.
One of the scenarios listed under the CDC guidance for certifying deaths due to coronavirus says, although no testing was done, the coroner determined that the likely underlying cause of death was COVID-19, given the patient's symptoms and exposure to an infected individual. So is the Minnesota state data reliable?
I don't think I have any position to question that per se. I know that I have talked with nursing staff who have been involved with people who have passed away that had either living wills or were on hospice care. In some of those situations, I've been led to believe that there may have been a COVID-19 diagnosis included on the death certificate document without having had a COVID-19 confirmed laboratory test, but I don't have any way to confirm that myself.
He says the public isn't stupid, and if you start messing with numbers, you're going to wish you didn't.
Weekend warning, stay at home, even in the sunshine, or people will die! Okay, Doomer.
People will only be allowed to leave their home for the following very limited purposes. 1 form of exercise a day.
Right. Let's see which one of us can touch his toes. 1, 2... 6079 Smith W. Yes, you. Bend lower. You're not trying.
And now we're being socially engineered to accept that this is all the new normal.
My next guest is a doctor and state senator in Minnesota who is deeply troubled by the CDC's latest guidance for counting COVID deaths. Dr. Scott Jensen joins me now. Doctor, I want to read for our viewers what the CDC says in part about how to count COVID deaths relating to that last issue we just raised. In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. So, doctor, what's the problem with that?
Well, in short, it's ridiculous.
Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor.
I spent some time earlier today just going through the CDC's manual on how to complete death certificates and the parts that were specifically written for physicians. And in that manual, it talks of precision and specificity, and that's what we were trained with. The determination of the cause of death is a big deal. It has impact on estate planning. It has impact on future generations. And the idea that we're going to allow people to massage and sort of game the numbers is a real issue because we're going to undermine the trust. And right now, as we see politicians doing things that aren't necessarily motivated on fact and science, the public's their trust in politicians is already wearing thin.
Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning. And it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling. Let's just take influenza. If I have a patient died a month ago, had fever, cough, and died after 3 days, and maybe had been an elderly, fragile individual, and there happened to be an influenza epidemic around our community, I wouldn't put influenza on the death certificate, and I've never been encouraged to do so. I would put probably respiratory arrest would be the top line, and the underlying cause of disease would be pneumonia, and in the contributing factors I might well put emphysema or congestive heart failure. But I would never put influenza down as the underlying cause of death, and yet that's what we're being asked to do here. I mean, let's just take someone getting hit by a bus, and they collapse a lung, and they go into the emergency room, and they're there for 15, 20 minutes. Blood work comes back, COVID test comes back positive, and they die 20 minutes later because of their collapsed lung. We're going to put that down as COVID-19? That doesn't make any sense.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people. And fear is a great way to control people. And fear is a great way to control people. And I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor